All right. Well, thank you. And thank you. Good afternoon, everyone. Welcome on our September 2nd meeting, September 2nd, 2021. And in honor this year, Board of Health, and I'd like to transfer to open the meeting to the chair of the meeting, Dr. Brophy.
All right. Thank you, Dr. Wendesor. And I hope everyone did well during the storm last night, and everyone is safe and well. I'd like to call the meeting of the Board of Health to order. The first item on the agenda is the minutes from our July 1st board meeting. Any issues with or edits to the minutes as written?
Nope.
Okay. Hearing none, can I have a motion to approve?
I set that motion.
Second.
Second.
All in favor? Aye.
Aye.
Thank you. All right, second item on the agenda is the board requested some statistical data on the COVID cases in the city of Brockton and some vaccination updates on the population. So, Dr. Montessori, if you want to run us through the data?
Yes. As of today, we have 221 COVID cases. 225, sorry about that, 225. That's the active cases. The cumulative, I noted it on the agenda as I was posting it on Tuesday as 15,200. As of today, it's 15,241. The death rate, we have recorded one additional death as of yesterday, as of Tuesday. So that brings us to 438 instead of 437 posted on Tuesday morning. Then furthermore, as we look at the other cases, basically we are right now at, as of yesterday, September 1st, the average daily cases for the last 14 days is 28.9 or 29 person per 100,000 inhabitants. The positive test rate is 3.86 in the city of Brockton. And then also as of yesterday, we did have 19 hospitalizations, of which 6 cases were in intensive care. So basically, it looks as though we are making some progress. We continue to see breakthrough cases as of this morning while we were with the PIH, the Partners in Health, the partner that helps us do contact tracing. We had over close to 20 cases which were breakthrough. Well, if we include J&J, basically close to 25 cases, slight number, slightly higher for Pfizer. Second was the Moderna, and third was J&J. However, the caveat is it would be unfair to simply give those numbers, given that we would have to look at the denominator of each number of vaccines that were given to see what number, what percent that breakthrough represents. So I just give the overall numbers of breakthrough for as of yesterday, for yesterday. So not any statistical significance of it because I don't give you the denominator.
Any questions from any of the board members?
Not here.
No, it looks pretty straightforward. Thank you.
I noticed it's obviously very difficult to get the percent of people in the city that have actually been vaccinated, probably because the vaccinations are happening at multiple places and sites. So is there any way to sort of an estimate of what how vaccinations have gone in the city?
Well, right now, the latest information that DPH provided shows that we are at 59.9% people who have first dose, and the fully vaccinated at 58.1. So they put out, DPH puts out the statistic once a week. Yeah, so probably they will give it later today for this week or tomorrow.
And do they break down by chance of the sort of under 18, or is it all just the general population within the city? I'm just wondering.
Yes, there is a break. There is a breakdown into ethnicity. I mean, it's a rough estimate because the way that the data are extracted, but I'll look for it as soon as I have it. I'll forward it to you.
Okay, great. Thank you. Thank you.
Yes.
All right. And then sort of next, I see you covered the dashboard items already, which was our fourth item agenda. But how about the city vaccinations are continuing? Do you want to talk about the vaccination efforts that are going on now?
Yeah, we continue to vaccinate. Right now, we have 3 standing clinics, vaccination clinics, 2 on Thursdays and 1 on Saturday. The 2 on Saturdays, one is at the Cape Verdean Association. Address is 575 North Mantello, from 2 to 7 p.m. The numbers drop significantly over there because at one point, over a month, about a month and a half ago, we were in the range of 30 vaccinations per clinic, but right now they roughly 19 to 22 cases a day. I mean, on Thursdays. The second vaccination site, on Thursday, is at the Shaw Center. That one is administered by the Yankee Line, although they provide it within the center itself, but that's where it is, and we support them. It's under the auspices of the Board of Health, but it's covered. The expenses are covered by DPH. The third one is at the Shaw Center on Saturday from 9 a.m. to 1 p.m. This Saturday, September 4th, we have decided that it might be a little bit difficult to run a clinic because first, the manpower that we have, the people are stressed out, so they might want the time to be with the family. Plus, people that might be coming may be out for the vacation for the long weekend. So we thought that we could forego the clinic for this Labor Day weekend. So we will resume on the 11th, on Saturday the 11th at the Shaws. And we also have pop-up clinics here and there. Last Saturday, we did an additional 3 on top of the one that we did at the Shaw Center. So those were like pop-up clinics, and 2 were at barbershops. So we managed to do them. So we continue. The numbers are fairly consistent in terms of low. Right now, we don't have any clinic that hits 30 in numbers, any one clinic. So they're under 30, all of them, but we continue to do the best we can. So what we see also is that we have a significant amount of waste because once we open a vial of any vaccine, we may not have people to administer the rest to. So what we do is simply let it go to waste because after 6 hours, we cannot use them anymore.
And the only other question I have is, with the booster shots coming up sort of towards the end of September, are there any plans on, continuing or increasing the number of vaccination clinics, or you'll just see how it goes with the current standing ones to see, because, when it started back when clinics became available, there was a larger number of people that were vaccinated. So folks coming in for boosters will be there on top of new vaccines coming.
Yeah, thank you so much. And I probably would seek your advice on that also, but here's where I see it and how I plan to move forward. I know that DPH hasn't really fully pushed for the Board of Health to do them. They also encourage patients or people who want them to contact their primary care provider for the third or the booster shot. So we encourage that. We do want to do it. However, we do not have the school nurses because they're back to school. School is back. I think today was the first day. We can put up the force, the manpower to do it, but I am being careful how we schedule the clinics, because once we do that, we want to make sure that we can deliver with the manpower that we have. Maybe right here, I should interject to say that by Wednesday, we will be down to 2 nurses because our longest serving nurse has tendered her resignation. So Wednesday will be her last day. However, she won't be here on Wednesday either because she has sick time that she is using. So in a way, we are already down to 2 nurses.
Okay, all right. So your plan just to continue the current vaccination clinics that you have, people may be coming in for boosters, you'll just see how, and you've been wasting vaccinations for now, so just to as the time for boosters become available, to just sort of assess the situation as it goes on, and I guess we'll have to go from there. I don't know if Craig or George have any other comments or suggestions.
No, this is a challenging circumstance given another nurse leaving. We just have to make the best.
You have to kind of see with the booster if you know, if you're going to need the extra help, if people are using it or not.
Right. Well, I think, also, Dr. Mansour, making sure that people know that, their primary care providers and many of the pharmacies, these are all available booster shots as well. It is no cost. There's multiple places to be able to get those vaccinations now. So I think, given our resources at the moment, even maintaining the clinics you have right now is probably going to be a stress on the department. So, we'll just have to see how things go as spring comes for those boosters to be to start being administered. So.
Yeah, I think in general we should always consider ourselves a second and tertiary option. More than not, the general population in Brockton have access to CVS and Walgreens and their primary care. It's the most marginalized that we're concerned about, and we're still really trying to focus on making sure that the most vulnerable are getting their primary shots and their second dose if needed. We're still challenged by that.
Right.
Yes, absolutely. So that's why I'm a little bit conservative or a little bit hesitant to say, okay, let's just go ahead and get ready to administer our third shot. We serve as a repository for the city and the surrounding, whereby we store vaccine, and then other providers get it from us for convenience sake. So we do that so that people, they can have the vaccine whenever they call us. They can just come get it, and then they can administer it and provide it at the sites.
Any other questions for anyone?
Nope.
Not here.
Okay, great. So next item on the agenda is the Partners in Health is being phased out. So,
Yes, I came in and I found that PIH was really a great help to the Board of Health through DPH, because they serve as investigators, key investigators to help in contact tracing and find out, all the people who have been exposed and help us process those cases. late November, December, I think the 23rd of November, their contract will end. But thankfully, the state has offered an alternative to us. Thanks to one of the PIH members and Dr. Herman, they were able to help us process grant application as of July 1st. And then over just about less than 2 weeks ago, we got word from DPH that we are considered a viable recipient. They got some paper, they sent us some paper to sign. So we are looking at about $1 million for 2 years, FY22, FY23. So that's $500,000 per year. Now, the restriction is that this money is supposed to be used to hire epidemiologists and community health workers to help us do COVID work, contact tracing that PIH will be leaving behind. So for this month, I'll be looking to work with our human resource department to be able to put the applications or the job applications so that people can apply. And hopefully by the end of the month, we will have some people and I'm expecting that by early October, perhaps first week, we will be able to launch it. The caveat to it is there will not be city employees, so they will not have any benefits because the grant is very restricted. And so in meeting with Department of Finance for the city or Troy Clarkson and his staff and HR, so we're bringing them in as contractors. And so the position will be dependent upon grant more money being available beyond 2 years. Otherwise, the position will be limited to 2-year term.
It's great that you got the grant, and it sounds like you at least have a pathway to execute against it that you'll be able to do. I don't know if there's if hiring is contracts as to the availability of the type of staff I know that you may need. I know it's a tough market right now out there for healthcare at the moment. So hopefully you'll be successful in getting folks into the positions. Any questions from other members of the board?
None here.
None there.
Okay, great. Well, congratulations on the grant and executing. If there's any way that members on the board that you need assistance or from the members of the board, happy to help. And let us know when the HR is ready to look for folks, and we can certainly make the among colleagues and people in the health community aware that the positions are open.
Yes, including the nursing position. The nursing position is basically city funded, and then so we'll be launching a search also. So that one is residency is required, but the others no. So okay. I probably reach out to all of you, including Dr. Andre, because I know at BU probably we cannot afford paying them the same amount, but maybe there might be somebody there just graduating or someone who may be looking for something to start or as a way to relocate in Brockton. So maybe we can find some people with training in public health to help fill these positions maybe a little bit quicker.
Yeah, unfortunately, BU doesn't have a nursing school anymore, but I will also share it at Massasoit since I'm a trustee there, as Dr. Brophy knows. So I'll make sure that they see this consideration. I'll spread the word around my nursing colleagues.
Thank you. Thank you.
Great. Okay, so the next item on the agenda is the Board of Health van project. An update on where we stand.
Yes, my hand has been stripped behind my back because the person doing the design has been waiting for a part from China. But when we called on Monday, they said, "Whoa, the part has arrived," and so therefore, sometime next week or in a short distance from now, we will take occupancy of the event. So that will be a relief because we will use it to for multiple purposes, to transport vaccines and to do clinics, and then to also do education and being visible out on around Brockton as well.
Wonderful.
Sounds good.
Any questions? Anyone?
No.
Okay. Oh, okay. Next item, I believe I've discussed that the nurse is retiring as of September 8th, and we'll currently be at 2 nurses, and as we've discussed, we'll be, in any way we can, we'll assist you in trying to find a replacement for the position. Next item is the reopening of the Brockton, back to in-person school and other activities that are occurring within the city. So.
Yes, of course, we work closely with the superintendent, Dr. Thompson, and Linda Cahill as the nurse supervisor for the schools. So they're back to operation, but we know this is there is a big if there. If a few cases of COVID are reported in the school, what that may mean, and so therefore. Department of Elementary and Secondary Education, DESE, has asked for masks to be mandated, and I know that the superintendent goes along with that, but we are vigilant, and we will be looking out to see how the opening in person affects the statistics, the COVID statistics, so that we may be able to jump on it and try to see what to do to maybe mitigate any spread rather rapidly.
Any questions from anyone on the board?
Not here.
Oh,
Right, and next item is digitalizing the Board of Health.
Yes, we are moving, whether slowly, but as you know, all our applications and forms, they are handled manually, and people cannot go on site to pay. They have to pay a certain way, and they have to come, most of the time they have to come here to get the application, or we mail a physical copy to them. So along with IT and the law department, we've been working in the mayor's office to see how to move from manual forms to digitalize to put them digital. And so therefore, there is a software that has been purchased and it's been approved. And so we will be having training within the coming days in order to be able to start moving our forms from manual to digital.
Any questions from anyone?
Nope.
no,
Okay.
nope.
Yeah, nice to be moving into the digital age there at the Board of Health.
Oh, man.
If you can get me to do it, would be great.
And you know, it's worth, in all seriousness, it's worth noting that there will be some people that still need to do it the old-fashioned way, but the majority will be glad to have that. We can't eliminate the ability for people to get something in the mail and be able to fill it out, because some people aren't either don't have the technology or aren't ready for it, but the majority will be glad that finally Brockton is going digital.
Well, it's
Yeah,
good to hear I
particularly-
won't be eliminated.
But George, you're the ultimate end user. If you can use it, anyone can use it, right?
That's absolutely true.
All right. So next item on the agenda, new names, new faces of the Board of Health. So why don't you some information on
Yeah,
happening.
unfortunately, I don't have any update for you. 2 weeks ago, I was summoned to present to the council chamber, but the agenda was so long, or the discussion went so long that they postponed the voted to postpone that session on the changing the name from Board of Health to Department to officializing it. So at this point, I'm still waiting to hear when they want to reconvene for the meeting.
So this is before the city council, is that right?
Yes, yes, ma'am.
So a document that's before the city council.
Yes, certainly.
And any questions on that from?
Oh, this is out of our control.
Yeah, is it just
Yeah,
a
if
name
it's within
change or a structuring of the board? Do you know?
Say that again, please. Come back again, please.
Is it a restructuring of the department?
Well, I know that will require some restructuring. I know it seemed that maybe about 2 years ago or so, it seemed that they have taken some steps to change the name, to name it Department of Health instead of Board of Health. And I think one of the stipulation is that they envisioning having maybe a physician also on board. But I have not seen the blueprint. I don't know what it looks like. Perhaps when we have the discussion, I'll have more details. But so far, I am a little bit limited as to how much restructuring they want to do.
So this sounds like the change that was passed by the council, I believe, before the pandemic of changing from a board structure to a department structure. So eliminating the Board of Health and developing a Department of Health under the I forget the law that allows that. So.
And if I may, again, Dr. Brophy, you and I have had this conversation. I think we all had this conversation with you too, George. The concern is that they haven't consulted us. Two, that they really aren't understanding what departments of health or boards of health or whatever you call them, what they do. Physician obviously brings value to it, but this is about the public health of the city. It's not about the health care of the city. And generally, it is about a public health frame and not a medical frame. And what they're considering really kind of highlights what they don't understand. And we can't keep nurses in our program right now, never mind trying to make other layers. I think it's they're just not thinking through completely. And there's upcoming funding that may be able to make departments of public health, boards of health and departments of health around the entire state have better resources, appropriate credentials, and all those kinds of things. That's coming, but this frame is a little bit premature and hasn't really had, I think, a full vetting.
Right. Yeah, and obviously, Dr. Andrews, this is your expertise, obviously, having written and done a lot of work on structures of Board of Health. So, do you think we need to, any action that we need to take, or you know, discussion with you know, offering to be at the table with the discussion for how this is framed, I think would be important, particularly with the expertise that you can bring, having, you know, how it is structured, whether it's you know, regional, whether it is just a city board of health and what our health department, and how that should be structured to not only deal with just clinical health issues, but yeah, you know, things like homelessness and things, other things that are issues in the city that fall under the domain of public health, and not just individual physical health within a community.
I don't know where the way, it's not clear, I think, to any of us that where they are in this process, but if they've already made a vote and voted on a particular structure, then maybe the horse is out of the barn. But I think there is value in at least saying that we have, and I'm also a member of the board of the Mass Public Health Association, and the way they do this structure will dictate how much money and resources we can get when federal funds come to do just what we're talking about. The state has received millions of dollars to help create a better infrastructure for local public health. And I worry that we may be shooting ourselves in the foot if we don't really understand what the standards they think should be in place.
Right.
I agree.
I don't know what the next step is, whether it's reaching out to the president of the council or what. I'm just very surprised that they haven't even considered talking to us.
I think we saw this format, wasn't it, a couple of years ago? I remember seeing
Yeah.
it.
Yes, it was.
And it was like a 9-member board, and then some other things. But I think, Craig, you said something like financially it's going to, you know, cost us a lot too. But you know, if they're going through it, we probably should see, you know, or hear about it. At least they should discuss it with us, I would think.
Well, again, I would, at minimum, they really need to make sure that they're thinking through the kind of unintended consequences that could make things not as successful as they'd like.
Right.
Right. And particularly since you have expertise in this and you understand this and can help them structure it in a way that they can get the most in this restructuring, get the most in the way of help and in the monies that are now available for restructuring the public health department, because clearly the pandemic showed how weak the system of public health is. And this restructuring is available, and we should try to for our city garner as much of the support that we can from these from the money that's going to be available. And if the way you structure it makes a difference in doing that, and the council and the mayor are not aware of these potential problems that may occur based on how it's put together, you know, we should you know, make them aware and of our willingness to help them in this structuring, so that they get the most money, but also align the public health system in the city to meet the personalized needs of this city. So
yeah, I've been on panels at the State House discussing this. I and one of our counterparts in New Bedford have often been asked to come in to provide this kind of testimony, to consider how these resources can reach places like Brockton. And it is, there are some important considerations. I'm happy to reach out to at least the mayor and get his guidance as to what to do. I don't know, who is the president of the council now?
Mr. Winthrop Farwell.
I'm not sure of the best way to connect. I know how to connect to the mayor, but I don't know how to connect to the president.
I can get you his phone number at this council chamber. I don't have it handy with me here, but I could.
Sure, if you just email me those, that would be fine.
Yeah, and Craig,
Okay.
maybe you could draft something coming from all of us on the board, just saying, that that we understand that this is happening, that exists within the board expertise and the consequences of aligning this in a way to produce, as the change in public health is happening and monies are becoming available, to assure that they build or frame this in a way that aligns with the plans to give us what we need and give our fair share of the monies that are going to be available, given the public health needs of the city of Brockton.
Yeah. Ideally, I'd love to be able to at least have a moment to talk with them and then follow up with that letter so that he has the
Okay, fine.
context. That
Okay.
way, at least he hears a person on the line and then knows the context to it to kind of take it in that way.
Okay, all right.
That sounds good.
Is that reasonable?
That is.
That sounds like a plan. So do we need to take any action on that, or a motion to have Craig as a representative of the board to have a discussion with the mayor about this, and then based on that, follow up with a letter from the board offering our support in this transition.
Do we need that?
Do we need it? To be safe, why don't we just say yes, and vote on it?
Okay, Craig, just do it.
All right, so I make that motion.
Okay, I'd second it. Craig
All in
handles it.
favor?
Aye.
Aye. Okay. Okay. All right, and then last item on the second to last item on the agenda is the health promotions and public health education.
Yes, we continue to do this also because since COVID is only just a small piece of what we do, even though it consumes, absorbs most of our energy, but we continue to work with the public, work with the churches, different venues, because we realize that public health is here with us, irrespective of COVID or not. And so we try to reach out to work with the public. There are other issues being considered. For instance, last Saturday, I was at a church where I was invited to represent the Board of Health. There is the faith-based community, along with someone from Boston Medical Center that is stationed at Bridgewater State University, came together to address issue of substance abuse and mental health. And so therefore, given that I am at the Board of Health, the director, and also I have been in the faith-based, I represent the faith-based also as the president of the a group of pastors in Brockton. So I was invited to the meeting. And so that's also another issue. So we continue to work to find how we can reach out to other providers, other people that are concerned about well-being, so that we can do a better job and making sure that the city has a more, a healthier population.
Okay.
Any questions or comments? Okay.
No.
Final item on the agenda is any miscellaneous or other things that the members of the board would like to bring up?
I have nothing.
Okay.
If the board doesn't have anything, I have one last piece. I did not want to include it on the agenda since it's kind of sensitive. You may be aware that, you're aware that I have requested waiver for residency because given my situation, COVID, and the issues at hand have not allowed me, to move. And so therefore I have placed a waiver. And just yesterday I got a letter inviting me to be to the board, to the city council next Wednesday, so that they could consider it. But unfortunately, I have to find a way to handle it. Maybe I'm open to your advice. Yesterday was my anniversary. I've been here for 1 year and I haven't taken any time off. So I have a standing engagement to take Monday, Tuesday, and Wednesday off. I mean, Monday is already a holiday, but I will be out. So I did not respond yet to the letter as to, do I have to be there or how do I move forward? So I was handed the letter yesterday afternoon, given my waiver, my request for a waiver, residency waiver is being considered.
And
Did it say that you needed to be there?
Well, they sent me a letter to present to the chamber on Wednesday, September 8th at 7 p.m. I think what happened is they ran out of time, maybe, and then considering that a Monday is a holiday, because normally they meet on the first Monday. Well, I mean, that's only one Monday. I think they meet 2 Mondays a week. So, I mean, a month, sorry. So next Monday, which will be the 6th, is a holiday. So they moved the meeting to Wednesday. But unfortunately, I have a standing obligation, even though it is something for me, but I have a standing obligation and I just received the letter yesterday. So I'm open to advise how to proceed. I have a meeting with the mayor tomorrow afternoon. I will check with him, but I don't know exactly how to best address it.
Just see if you can wait till the next month, the next time they meet.
This is a transactional thing. They know, everybody knows you need to be in the position. You can show up the fall. You said it's 3 different opportunities. Show up ask them to put it on the agenda for the next thing, because you have an obligation that you can't. You don't have to give them the details. You have an obligation that you can't refuse, and you respectfully want to make sure that you can be there at that time. You just got the letter. They only gave you less than a week's notice. You have this obligation that you cannot change.
right.
Okay.
Yeah,
Thank
that
you.
seems fine.
Yeah, that's what I would recommend. Ask them to defer it to the next meeting, and because of this, and it is very short notice to say that you need to suddenly appear within it's probably less than 48 hour, a little more, 72-hour time period. So.
Okay.
Use the word respectfully request.
Amen. Thank you.
All right, and final agenda item is, if there's no other items, is planning our next board meeting, which will be on Thursday, October 7th at this same time. So.
Okay.
Great.
All right. Entertain a motion to adjourn. All in favor?
So moved.
Second.
And all in favor, aye.
Aye.
Thanks everyone for coming for the meeting, and look forward to meeting with you next month. In the meantime, if any activity comes up or a meeting with the mayor or Dr. Montessor in relation to this, please let us know of your position. We certainly support you 100% in the effort that you've done, and realize that you've been working nonstop throughout this pandemic, many weekends and nights as well. So, and appreciate the work that you've done and that your department has done throughout this time period. So,
Thank you very much.
Thank you.
Thank you all. And
Take care.
we'll meet.
Have a good weekend.
I'm very humble working with you. Thank you so much. Happy Labor Day weekend.
You too.
You too. Take care.
Thank you.
Take care.
Thank you.
Bye-bye.